Hello everyone, welcome back to another video or welcome to another video from me. And in today's video, we are going to talk about everything an MRI tech should know. This is very important because I want you all to know it's okay to be behind on your schedule. It's okay to increase slices. It's okay to reschedule someone. So put it in the comment box if you are an MRI tech, if you are an MRI student, if you are looking to join MRI school, if you work in a hospital, or if you work in an outpatient imaging clinics, because all of these things are important. It's going to help me make my next video that I want to make about MRI. So I'll get right into it because a lot of times I think as MRI techs, we are under like a lot of pressure and we make mistakes or we can make mistakes because we're like racing against time and we're like trying to beat the time. So let me start by saying this as well. It's okay to step away for your 30-minute lunch break. So a lot of times when I work in MRI, I do not eat and scan. Like um, I go outside and I take my lunch break. I do not eat in the MRI tech area. I step away for 30 minutes. I've tried it one time where I'm trying to, everyone else is eating at the scanner. Let me eat and scan. It doesn't work out like that because you're not really taking your full 30 minutes. You're answering a phone call. Someone else is bothering you about a question or someone else. So it's okay to step back and take a break. Now, if you're just snacking, eating chips or something, that's fine, to do that like in the area. But if you're trying to relax and um, step outside, I will say that. So when we work in MRI, a lot of people make these mistakes. And one of the mistakes they make is they're trying to like clear their list or clear their schedule or stay on this strict time schedule. Because I worked at outpatient or in outpatient imaging clinics and I worked in hospitals. So I know how the worlds work between outpatient and hospital. I know. So I know we're trying to stay on schedule. When we get behind schedule, you're cutting down all type of things so that the scan can go faster. So what's happening? You're jeopardizing your image quality. The patient may have to come back. You're probably going to hear something about your images turning out, not well. So I want to talk about some things. So regarding, let's talk about slices because I feel like I may forget this. Whenever it comes to slices, it's okay to increase your slices. So I was working with someone and I noticed that this person, like, it wasn't even a centimeter that they had like above like scalp area for the brain. And I'm like, what if this patient moves, which it probably will happen? What if you clip something? It's okay to add two, three, four slices so that the patient is not coming back. The worst thing that's going to happen is the patient may be in there for, I don't know, 10 or 15 more seconds. You have 10 or 15 more seconds to save versus someone coming back to have the scan done again. So I would say it's okay to add slices. I know you're trained to don't add a lot of slices because it's going to add a lot of time. And I would say add the slices, whatever you need to add to avoid clipping anatomy because it doesn't look good. It's going to fall on you as the tech who clipped the anatomy. Now the patient have to come back. What if the patient have, problems where they need treatment and now they have to wait to get back on the schedule? So it's okay to have more. I'd rather have more than not enough. That's my saying. And then another thing is, it's okay to refuse someone or reschedule someone. If someone has an implant and they don't have a card, it's okay to say, I'm sorry, you have to reschedule. If you're saying that you have a brain shunt, we need to make sure that that is exactly what you have because people get confused all the time. They get confused between, let's say, a shunt and a pacemaker. They may get confused between a CT scanner and an MRI scanner. Believe it or not, when you have work, because I work in CT too, I work in other modalities, but believe it or not, when you have worked in CT and MRI, you get patients that come to CT and they want a towel over their eyes. And we're like, this is only going to take 1 minute. Oh, I thought this was an MRI. And then you have patients who come in the MRI scanner and they come in with the pacemaker with all type of metal and they're like, oh, I thought this was CT. So it looks very similar to someone who does not know the difference is pretty much what I'm saying. So if someone is saying, don't take anybody's word for anything. If someone is saying that they have something in their body that they were not born with, and it is like an electronic device or an implant, if they don't have a card, they need to reschedule until they get the card. It's just simple as that. You may upset someone, but at the same time, their safety is what matters. So don't be afraid to reschedule someone. Of course, you can reach out to your radiologist if you have any questions about something. Me personally, if it's something relating to a patient's safety, I would reach out to a radiologist over a supervisor because the words travel differently. I've had this happen to me before where someone told me, the rad said it's okay to do this, and then I go and ask the rad, and the rad was like, I never said that. So the words can get like twisted and just taken out of context. So it's just better for you yourself. My saying is, I have a lot of saying. One of my sayings is no card, no scan. And another saying is, if I'm gonna do the scan, I'm gonna, clear everything. So another thing is, so it's okay to get behind. Another thing MRI techs need to get in the habit of doing, whether you're working in outpatient or if you're working in a hospital, you need to check those prior X-ray images because I've had a situation that happened, but thankfully I caught it where someone said, okay, this patient is clear. All they have is a pacemaker. Come to find out, the patient has a pacemaker and a stimulator, but the stimulator wasn't clear. No one knows the model, the make, if it's right for this machine. No one knows anything. So don't rush to put someone on the scanner. If it's like that big of an emergency where the patient needs a scan, they will go to another hospital and get squeezed in, or someone else can accommodate them if they can't get back on your schedule if it's that big of like emergency. And then so make sure you're looking at the x-rays, CT scans. I always check x-ray, chest x-ray, KUB x-ray, and I check CT head scans, for the aneurysm clips, for any devices, shunts, different things like that. I do not mind and I'm not afraid of going to ask the radiologist questions because I always say there's no such thing as a dumb question. And a lot of the radiologists is like very helpful. I wait until they stop, reading or dictating before I ask them a question. If I like come over there and I see that they are like in the middle of reading something, then I don't bother them. But after they get done, I just ask them my questions and they'll appreciate that because you're not going to just do any scan. Another thing that you need to know is if you see that an implant is MRI conditional, let's say a stimulator. If you see that a stimulator is MRI conditional, it doesn't mean that it's okay to scan on your scanner. You know, we all we all have been trained by different people. Some people can train us well and some people can't. Some people give us the information and some people don't. And I was one of those ones. I told it in my story. It's like the pros and cons of an MRI tech. I'll try to link it or remember to link it to the end of the video so you can check it out. When I was in MRI school, I didn't have anyone training me properly. I had people tell me, go look on this website to see how to scan. So my experience for MRI wasn't the best. I almost like not wanted to be an MRI tech, to be honest with you. So um, I kind of like had to learn on my own through trial and error, And what I mean by error is when I was scanning people, sometimes the images wasn't coming out like clear or whatever. It was like grainy, or it just didn't have enough signal. So through research, through texting people, I was told make sure that you have the core selected. I was working on semen scanner, so I clicked that button, or I looked up and I noticed that the core wasn't selected. So with the implants, even if it's say MRI conditional, you have to make sure that it can be scanned on your scanner, because it may be like the stimulator that they have. It may say transmit receive, or receive only, or transmit receive only, something like that. And it may give you those words, or it may say patient can be scanned more than 15 minutes, pause and then scan. So you have to look at all of that. You can't just say, oh, it's MRI conditional and scan, because I know veterans, that with in MRI, that would just they honestly, they don't know. If no one never teach you, then how can you know, or whatever. So that's one thing. Another thing is with your contrast, know the different terminology for contrast, because there was a time where someone came in and I verified allergies for everybody. If I'm giving contrast, I verify the allergies. And someone came in, and I think on the chart it said allergic to gadolinium or something. It didn't say dodorum. It was like, I think it said gadolinium. So you have to know the different type of contrast, use the MRI. If someone is allergic to Ilvish, that's MRI contrast, so they can't have it. If someone is allergic to Clariscan, that's an MRI contrast, they can't have it. If someone is allergic to, it may say gadolinium, it may not even say dodorum. You have to know that is like an allergy. Um, I'm trying to think of something else. I really can't think of anything else. That's like the main thing that I could think about, what every MRI tech should know. Also, when it comes to pacemakers, you don't want to make it seem like you don't trust your team members, but at the same time, you can't trust anyone. You have to verify behind people. If my thing is this, if you verify the x-rays, you need to be the one to do the scan. If you verify the MRI clearance form, spoke to the nurse, spoke to the doctor, spoke to the radiologist about how this patient needs to be scanned, you have to be the one to do it, because I don't know what they told you. I don't know if you screened this patient right. I don't know. Maybe you missed the pacemaker that this patient has, which has happened before, with text. I don't know these things. So if you looked at the information, unfortunately, you need to be the one doing the scan. And when it comes to relieving people for lunch, especially you work at a place where you have to relieve somebody for lunch, it is better to just let that person finish the scan, because what if this person forgot that the patient has a glucose monitor on, which can burn the patient, or they forgot to remove the EKG leads off because it has the little metal piece on it, and the patient end up being burned. Or what if they, didn't want them to change? That's another thing. I change everybody. I don't care if they came in with all cotton on. I change them because I don't want anyone forgetting anything in their pocket, and they say that it's my fault that their cell phone got destroyed, that their cars got destroyed, or they got burned. So at the facility I work at, it's unlimited gowns, it's unlimited scrubs. We don't run short. So I change everybody. Yeah, some people may not like it. They may say, well, the last person didn't make me change. Or they may say, why are you changing someone for a brain scan? They just have on pants. You just never know what may happen, so it may not have happened to that other person, but it may happen to you. So just change everyone. Don't look at it like oh, it's just a 10, 15 minute scan, nothing's going to happen. Just change the patient, because at the end of the day, this is going to save you from a lawsuit, save you from losing your license. And another thing is, don't be afraid to wand people, because I know MRI techs who have had like 20, 30 years of experience with MRI, and I still see them wanding people. Um, and then another thing, this conversation came up with someone. So you need to give everyone earplugs. It doesn't matter if they want earplugs or if they want earplugs and headphones or if they want headphones only. Give these patients some protection. If someone come in and they say, I'm deaf, I don't need earplugs, I'm sorry, I still have to give you earplugs. Someone may argue and say, why give someone earplugs that is deaf? They're not going to be able to hear anything anyway. How do you know that that patient is truly deaf? What if the patient is not deaf? What if they're just testing your knowledge to see if you're going to give them earplugs or not? What if they are a mystery shopper? What if that they're really not deaf, and then you did the scan and now their hearing is impaired, and they lost their hearing, and then you can get sued? Because I've had people come in to say, I want to use my own earplugs. I'm sorry, you can't use your earplugs because your earplugs have not been FDA tested to stand, can stand the sound of our machine, but our earplugs have been. They can't use their own headphones. Um, so it's a lot of things you have to know. It's going to come with experience. It may sound silly to put, someone in earplugs who may be deaf, but what if they're not deaf? And even if they are, even if they do have some hearing loss, some people, depending on the type of person, where they live, where they're from, some people have ways of communicating things, saying things. Like, I may tell someone, I'm blind, I can't see anything. I can see, but I need my glasses to really see, if that makes sense. But anyway, I just want to throw that out there, because some people think that you should not give patients earplugs if they say I'm deaf, or if they say, no, I don't want it. I work at a factory or I work in the airport. It's loud anyway. I never wear them. You may have someone say, I never wear them. The last person didn't give it to me. Still give the patient earplugs. And I just want everyone to be successful in radiology. You work this hard to get your license. Work even harder to keep your license, pretty much. I want everyone to make it. That's why I have, like, on my channel, I have a lot of educational videos to help X-ray, CT, MRI, mammo students pass their registry, hopefully on the first try, but that's on them, if they're studying how they should be. But I'll give out the resources. It's just up to you if you want to take it, if you want to listen, But I can't think of anything else. I think that's like what I gave is like the most important things that you need to know when you're working in MRI, because unfortunately, you may get called in the office, and at a time like this where it's not really good to, be taking chances and losing your job. I would just say, just follow these tips and good luck. If you have any questions, put them down in the comment box for me. I'm just able to share this knowledge because I've worked in outpatient and a hospital setting. So I've seen how things work both ways. I've seen it where you're back to back. I've seen it where you're slow, you're waiting for a patient. You may scan a patient, two patients in 1 hour, or you may scan um, four patients in 1 hour. You just never know. But anyway, if you made it this far in the video, could you please put I made it this far, or great job, or thank you, or put like an MRI brain symbol emoji, or the MRI metal symbol emoji. I don't know, just put something in the chat for me to know that you made it this far. But other than that, thank you all for watching. If you have any questions, feel free to leave them down in the comment box. Also, could you please give the video a thumbs up? Please like, share, and subscribe. And I will see you all in the next video. Bye.